So I would like to welcome everyone to Section 2B, Health and Safety Standards for the fiscal year 2023-2025 Tribal CCDF Plan Preprint Training. We would like to begin by introducing you to your health and safety training team for today. My name is Sarah English, and I am the Tribal Technical Assistance Specialist for Regions 1 and 6 with the Tribal Child Care Capacity Building Center. I am joined by my colleagues today, and I will turn it over to them to introduce themselves. Teresa?
Thank you, Sarah. My name is Teresa Campbell, and I am a Training and Resource Development Specialist with the Tribal Child Care Capacity Building Center. This afternoon, we will also have Tammy Charles join us. She is a subject matter expert in tribal comprehensive background checks with the National Center of Subsidy, Innovation, and Accountability. And she will join us shortly from the Chicago trainings. I will now pass it back to Sarah.
Thank you, Teresa. As we move forward in the presentation, please feel free to say hello to the group and enter any questions you have in the chat. Thank you for joining us today. Just remember, you can request any additional technical assistance from our team by reaching out to your regional office. On the screen, you will see our objectives for this session. We will be covering the components of a monitoring system, the health and safety exemptions that are allowable for relative providers, and comprehensive background check requirements. Section 2, Health and Safety, covers 5 different subsections, including standards and monitoring, training requirements for CCDF providers, monitoring and enforcement policies and practices, exemptions for relative providers, and comprehensive background checks. We covered the overview of health and safety standards and monitoring and health and safety standards and training requirements for CCDF providers in Section 2, Part A this morning. In this portion of the health and safety training, we will focus on Sections 2.3, Monitoring and Enforcement Policies and Practices, Sections 2.4, Exemptions for Relative Providers, and Section 2.5, Comprehensive Background Checks. If you haven't already attended the Section 2 Part A workshop on the health and safety standards and training, please make sure to get your access to the recording of that training or let us know, and we can send you a copy of the slide deck and presentation notes. Section 2.3 covers monitoring and enforcement policies and practices for CCDF providers. It may be helpful to follow along with us by looking at a copy of the Plan Preprint, which you can find at the Tribal CCDF Plan Preprint training website, where you registered for this session in the resource tabs. We will also drop a link in the chat. Let's move into monitoring and enforcement now. I will now pass it to Teresa.
Teresa, you may be on mute.
Oh, thank you for that. Sorry. Okay, tribal lead agencies must certify that procedures are in effect to ensure that child care providers caring for children receiving CCDF services comply with all applicable tribal and/or state and local health, safety, and fire standards, and will identify this in their FY 2023-2025 tribal CCDF plans. This certification may include, but is not limited to, any system or systems used to ensure that providers caring for CCDF children meet your health and safety requirements, any training documentation required to be maintained by child care providers, and any other monitoring procedures to ensure compliance. A monitoring system begins with your standards. As a tribal lead agency, you will establish these standards, train your providers on the standards, and then the providers begin caring for children. But how do you know that they are upholding their standards? You do that by inspecting facilities, observing providers working with children, talking with providers, and reviewing provider documentation. Finally, enforcement in the ways in which you address a provider that is not meeting your standards. Monitors will be trained by the tribal lead agency, the state, health, Indian Health Services, or other partner entity. This training will include how monitors should confirm compliance with your minimum health and safety standards and fire safety requirements as indicated in your formal standards and your policies and procedures documents and in section 2.1.1 of your plan. Tribal lead agencies that partner with monitoring entities, including IHS and state, for all CCDF providers, including tribally operated centers, must validate that the monitoring entity is aware of all health and safety requirements and monitoring expectations. The initial report will assist in determining whether a provider or center is ready to begin caring for children or needs to address inspection findings prior to starting care. Remember, if you are using a separate entity such as IHS to conduct your inspections, you will still need to train the monitors in your specific health and safety standards and ensure that they are monitoring for your standards as opposed to a generic set of standards that may not incorporate all of your requirements. Describe the tribal lead agency's policies and practices for annual inspections of CCDF providers for compliance with health and safety and fire requirements for each category of care, including how it is carried out and by whom. The pre-inspection of licensed and regulated providers is the initial inspection by a trained monitor who examines the home or facility where child care will take place. This initial inspection must take place prior to any formal child care occurring at the home or facility and will assist in determining whether a provider or center is ready to begin caring for children or needs to address inspection findings prior to starting care. In addition to the initial inspection prior to caring for children, licensed and regulated centers, family child care providers, and in-home child care providers are subject to an annual unannounced inspection by the tribal lead agency. During this inspection, they will begin monitored to ensure they are meeting the tribal lead agency standards, policies, and procedures. In your plan, you will describe your policies and practices for annual unannounced inspections of licensed and regulated providers, including the frequency of such inspections. In your description, identify the frequency of inspections for each of these categories of care, as well as any details regarding your policies and procedures for the inspections. You can answer not applicable for in-home child care providers if they are not regulated. Tribal lead agencies are exempt from the requirement to have a licensing system and may use the terms tribally approved or tribally certified to describe their provider types. If you have state licensed providers, you may have heard the terms used by the state, such as state regulated centers and license exempt programs. These are all different ways to regulate providers. Does the tribal lead agency have a standalone licensing system? Remember, tribes are not required to operate a licensing system, but can choose to do so. Also, tribal lead agencies do not need to describe a state licensing system for state licensed providers in their plan. Only describe if they operate a standalone tribal licensing system. If your answer is no, you can skip to 2.3.1.3. If yes, describe the tribal lead agency's pre-licensure inspections and annual unannounced inspections for licensed CCDF providers, policies, and practices for the following categories of providers: child-based child care providers, family child care providers, and in-home child care providers. Tribal lead agencies have flexibility in determining who conducts the monitoring and inspections, and have the flexibility to propose an alternative monitoring approach for care according to the setting. In your justification, you must describe how the alternative approach is appropriately comprehensive and protects the health and safety of children in care. Tribes cannot use this flexibility to bypass the requirements altogether, but may introduce strategies that are more culturally appropriate or more financially feasible for their communities. These alternative approaches are subject to the approval of the Administration of Children and Families Office of Child Care. A resource we would like to highlight at this time is a program instructions from August 2019 that provides guidance on alternative approaches for the purposes of conducting background checks on child care staff and monitoring and inspection of child care providers. We will drop that into the chat for you. Excuse me. Another resource that may be helpful is the monitoring alternative tips and considerations for tribal lead agencies of all allocation sizes. And that will be dropped into your chat box for your access as well. I will now pass it back to Sarah.
Thank you, Teresa. Training must include, but is not limited to, prevention and control of infectious diseases, including immunization, building and physical premises safety, and minimum health and safety training appropriate to the provider setting, including all aspects of the requirements detailed in Section 2.1.2 of your Tribal CCDF plan. Monitors are trained in the unique standards and the policies and procedures that the tribal lead agency has adopted, adapted, or developed so that they understand what the caregivers, teachers, and directors must adhere to, and to understand what they are inspecting and monitoring. Included in their training should be information specific to the child care provider setting type and the age of children served, as well as culturally respective practices. In Section 2.3.2.1, you will describe how you will train your inspectors or monitors to ensure that they are equipped with the skills and strategies necessary to inspect child care facilities and providers. For example, you may include inspectors and monitors in your annual pre-service and ongoing training activities to familiarize and refresh them of your standards and policies and procedures. And you may choose to provide a separate training, such as the ones found on the National Association of Regulatory Administration's website in their online training courses and their annual national licensing seminars. We will put their web link into the chat box for you. There are many other ways to get the training necessary to guarantee quality monitoring. For example, attend face-to-face training sessions that might include hands-on learning activities, such as role play or different monitoring situations and practices. Reach out to the state licensing agents and participate in their training they provide to their staff. Utilize the Office of Child Care's TA Center's monitoring toolkit material for training, which you can find on their website and on the TCBC website. This link is currently not available due to some upgrades, and so we will be releasing that later this month, and so hopefully you'll be able to find that shortly. Remember that your monitoring system includes ensuring that your providers follow your health and safety standards, as well as the training requirements as detailed in your Tribal CCDF plan. Your standards, training, and monitoring practices work together to create a system to ensure the tribal lead agency is meeting the CCDF final rule requirements. Although each requirement operates independently, they must all be connected to create a comprehensive health and safety system that meets the health and safety requirements. One piece cannot be broken or missing. They must move together. For this next activity, we will review some questions regarding the monitoring system. Let's talk a little bit about how you train and monitor your monitors and inspectors. This includes your contracted monitors to ensure that they are adhering to all of your unique standards and your policies and procedures when they inspect facilities, observe providers, meet and talk with providers, and review provider documentations. The two questions are, what training strategies do you have in place to ensure that your monitors, inspectors know and understand your standards and your policies and procedures? What enforcement strategies have you provided to your monitors and inspectors to review and document that your providers, caregivers, teachers, and directors are following your standards, policies, and procedures? For this activity, we will engage in a large group discussion, asking you to consider each of the two questions posed. Together, we will discuss potential or current strategies for each question and possible alternative approaches that could be incorporated into the process. The TCBC team member will be taking notes on any idea boards, which will also be opened to you to post on as well as engage in the discussion. You will see the idea boards link in the chat box. Please click on that link, and once you are in the room, you will see green plus buttons. You can click on the plus buttons to generate a virtual sticky note. Once the sticky note is available, you can type your ideas onto the note, and they will be shared with the group. You can also unmute and share your ideas with us, and we will write them on sticky notes for you.
We will be opening the breakout rooms now.
Welcome back, everyone. I know it's what seems like a hot minute whenever you're in the breakout rooms, that you have not a whole lot of time to get everything discussed, but we still want to provide you with that opportunity to come together and have some of those small group interactions. And so one of the things that we want to mention before we move on is that ideas board link is still going to be accessible to you. You can click on it and see some of the ideas that were put on there throughout all of the different groups. And some of the things that were talked about. So before we move on to our next section, I'll give a brief overview of some of the items that were talked about. And really it was looking at, inviting providers and monitors to those same sets of training so everything could be heard and you could get feedback and kind of move forward. Many of the tribal lead agencies discussed that they might use the state for their monitoring aspect. But as a result of COVID and looking at some of the different components of it, maybe looking at a hybrid approach of starting their own monitoring system and what that might look like through their plan. And I know Ideas Board didn't cooperate with everyone. And so you may even be able to look through the chat box and see some of the different comments that were made about Some of the monitoring that happens by the tribe while it's on reservation and allowing for state partnerships outside of the reservation and expanding some of those services. Okay. Thank you all for sharing your ideas and your information, and we will now move on to our next slide, and I'm going to pass it to Teresa.
All right, so the education of the monitoring staff is a key aspect of a successful monitoring enforcement system. Monitors, including IHS and state monitors, need to be trained to ensure that all your health and safety standards are followed, including staff to child ratios, group sizes, caregiver teacher qualifications, caregiver, teacher, and director training, and comprehensive background check requirements are being met. Well-defined standards, policies, and procedures, and inspection tools and checklists, which can be found in the monitoring toolkit that will be posted due to the update that was mentioned earlier shortly. That can support your training processes and lead to the success of your monitors. In this section of the plan, you will describe your training strategy and identify a timeline for the completion of initial monitoring training and any ongoing training requirements. The tribal lead agencies must have policies and practices requiring the ratio of inspectors or monitors to child care providers and facilities. As you begin to think about your options, note that the ratio must be at a level sufficient to conduct effective inspections of child care providers and facilities on a timely basis and in accordance with tribal, federal, state, and local laws. You could refer to your state's plan to see what their ratio is and then determine if you feel it is sufficient for adequate monitoring. Tribal lead agencies have the flexibility to determine what the best practices are for the ratio of inspectors to child care providers. In this section, you will describe the policies you have for this and any practices that accompany those policies. Next, we will be shifting our focus to section 2.4, exemptions for relative providers, and I will pass it back to Sarah to cover that topic.
Thank you, Teresa. In section 2.4, you will check and describe, where applicable, the policies that the tribal lead agency has regarding exemptions for eligible relative providers over age 18 for the health and safety requirements. CCDF considers eligible relatives to include grandparents, great-grandparents, aunts, uncles, and siblings who live in a separate home. The description should include the health and safety requirements that relatives are exempt from, if applicable, and which of the federally defined relatives the exemption applies to. This exemption can only apply to relatives who are caring exclusively for their relative children and no other non-related children. In this section, you will need to identify whether relative providers are exempt from any or all health and safety standards described in 2.2.1, 2.2.2, 2.2.4, and 2.2.6. If relative providers are exempt from a portion of the health and safety standards, please describe which of the standards they are exempt from. Remember to note if the exemption includes all relative providers or only some relative providers. For example, a tribal lead agency might exempt all relative providers from some health and safety standards, while exempting grandparent caregivers from all health and safety standards. Tribal lead agencies can elect to exempt relative providers from training standards as described in sections 2.2.2 and 2.2.3. Identify which, if any, training requirements you are electing to exempt relative providers from completing. If you choose to exempt relative providers from health and safety standards, you can still invite them to participate in trainings that address those standards if you want to expose them to the materials and information. Remember, you could also adapt your training for relative providers. For example, instead of going to an in-person training for safe sleep practices, a grandparent could review a pamphlet or article on sudden infant death and safe sleep practices with your staff during an initial onboarding meeting. Tribal lead agencies could also determine which, if any, monitoring and enforcement requirements relative providers are exempt from, as described in Section 2.3. If you choose to exempt them from a portion of the monitoring and enforcement requirements, be sure to identify which ones you are exempting them from. We have another resource we would like to spotlight: the Monitoring and Enforcement Policies and Practices, Tips and Considerations for Tribal Lead Agencies of all allocation sizes. This resource can be used to make sure important decisions as you develop or revise your policies and practices for monitoring. We will share a link to this resource with you now in the chat. Let's take a moment for questions. Please feel free to unmute or raise your hand or enter questions into the chat box. And remember, you can always reach out to your OCC program specialist as well. One of the things I will highlight that we hear frequently is the definition of grandparents and aunts and uncles. We do want to highlight that there is the requirement for that to be either through biological or court decree legal standing whenever you're looking at those definitions of those individuals for relative providers. Okay, so now we do have Miss Tammy Charles with us. And so I'm going to turn it over to Tammy Charles. Thank you.
Thank you so much, Sarah and Teresa, for all the information that you've shared. So as we transition to Section 2.5, it addresses the Child Care Development Block Grant Act requirement. The tribal lead agencies across all allocation sizes must have, in effect, requirements, policies, and procedures to conduct comprehensive background checks with the acronym of CBC for all child care staff members, including prospective staff members of all child care programs that are licensed, regulated, approved, or registered under tribal law. This includes your tribally operated centers, and for all other providers that are eligible to deliver CCDF services. And some examples could be license exempt child care providers that are eligible to deliver CCDF services. The CBC components in the FY23, FY 2025 tribal plan have been reordered. Just want you to keep this in mind as you complete your plan if you're using your FY 2020 through 2022 tribal CCDF plan as a resource. Also, we'd like to talk about interchangeable vocabulary. In-state is the same as current state of residence. Place of residency in the last 5 years is the same as previous state of residence or interstate checks or out-of-state checks. Just want to make sure that you understand they all reference the same battery of checks. And now you're reviewing a one-page document from the National Center on Subsidy, Innovation, and Accountability that is the Tribal Background Check Requirement Highlights page. The CCDF requirements for conducting background checks apply to the following individual. That's any existing staff member or potential staff member who is or will be employed by a child care provider for compensation, any individual whose activities will involve the care or supervision of children, your contract employees, cooks, maintenance staff, and etc., self-employed individuals, which could be your in-home childcare staff. Also, any individual who will at any time have unsupervised access to children. As it regards to family childcare homes, all comprehensive background check requirements are required for the caregiver specifically, unless the main caregiver is related to all children in care. CCDF comprehensive background checks are also required for other adults age 18 or older residing in family childcare homes. Tribal lead agencies can choose to exempt qualified relative caregivers from some or all of the health and safety requirements, including comprehensive background check requirements, only if the individual is related to all children in care and they meet the defined relative definition at 18 years of older siblings, grandparents, great-grandparents, aunts, and uncles, as long as the siblings reside in a separate residence. Tribal lead agencies are allowed to submit for alternative approaches to several items in Section 2.5. These items will be noted and we'll discuss them as we work through the presentation. Under the CCDF rule, a comprehensive background check includes up to 8 separate and specific components. Tribal lead agencies will be asked to describe the methods used for the background check components, such as the database or repository that is checked, or a memorandum of understanding, an MOU, or a memorandum of agreement, MOA, or a contract with the state or a third-party vendor to conduct the checks on behalf of the tribal lead agency. Let's talk about the comprehensive background check requirements and how they're categorized. The background check requirements are broken into 3 primary categories: in-state, which is your current state of residence. That's the criminal history, a sex offender registry, and the child abuse and neglect registry. The national checks are 2. They are required are the FBI criminal history and the FBI National Sex Offender Registry, known as INSOR. The third category is in-state check or interstate checks. Those are any states of residence within the last 5 years. This refers to any and all states where the individual or prospective employee has resided in the previous 5 years. Those required checks are criminal history, sex offender registry, and the child abuse and neglect registry. For each background check component, tribes need the authority to conduct the check, and they also need access that's necessary. Does anyone have any questions on these categories? As we move through the process, tribal lead agencies will need to make some decisions along the way. How will they conduct each check? Will you enter into an MOU or an MOA with another agency? Will you use third-party vendors? Are you searching your tribal registry? As stated in the preamble of the CCDF final rule, ACF expects that the tribal lead agencies will conduct some components of a background check for all individuals. Are you using an alternative approach? Tribal lead agency may use an alternative approach, and we will describe those in section 2.5.7 for any in the section of 2.5. All alternative approaches are subject to approval from the Administration for Children and Families, and they will not approve approaches with blanket exemptions that bypass the intent of protecting children's safeties. Are you using state licensed providers? If you are, it is not necessary for you to conduct additional or duplicate checks if the provider has already met a state prescribed CCDF background check. If you're using family care providers, family child care providers, you'll need to do the components specifically for the lead caregiver and the other household members. Again, ACF will consider alternative approaches for limiting the background checks for household members, but still protect the children's safety. Tribal lead agencies, again, any that use an alternative approach, will define that at 2.5.7. If you're using relative care, be sure they meet the defined description by CCDF regulations and declare that in your plan. Your tribal lead agency will need to determine if you require comprehensive background checks for relative providers. And I think we had a question. Sarah, can you bring that up, please?
I can. Our question is, how do we gain access to the State Child Abuse and Neglect Registry?
Thank you so much for asking that question. Oftentimes, tribes will enter into an agreement for the state to conduct the checks on their behalf. It is, of course, varies on a state by state basis as to the tribal relations that are conducted. But again, these components that are prescribed are the ones that are lettered in the law. And as I stated earlier, you have the option to do alternative approaches, and we'll talk through that as we go through. Was there another question, Sarah?
There was. Is there a specific form to use when conducting these searches?
Again, that's going to depend upon the agency and how you conduct them. Of course, the FBI checks have prescribed forms that have to be utilized for those. And we'll talk about statutory authority in just a little bit and give a little more explanation on that. But as far as the forms and the records and the data keeping, that's going to depend upon the agencies and the registries and databases that you're working with.
I think that's all of the questions that we have at this moment.
Okay, thank you so much for bringing those up. So now we're going to talk about how the plan is structured. Each of those independent checks that we just talked about is accompanied by a table. And with that table, there will be a list of pre-approved or pre-described methods, as well as some alternative methods that you can select from. And each of those 8 requirements has a table when you work through the CARS system. At the end of each table is a question that they're asking the tribal lead agency to provide information on the state or tribal databases or registries that were searched to gain that information. So the first section of the background checks that we're going to discuss in alignment with the Tribal CCDF plan are the in-state or current state of residence checks. The first table is focused on the current state of residence criminal history check. It must be conducted with a fingerprint, and searching any public-facing judicial website does not satisfy this requirement. This state-based check must be completed in addition to the FBI fingerprint check and any previous states of residence check in the last 5 years. We do that to mitigate any gaps that may exist between reporting sources. As you complete these checks, you may wish to consult with your HR department or a third-party vendor, if applicable, to assist you with completing this section of your plan. Oftentimes, tribes will work with states to conduct this check for them. The check associated is a state check last 5 years. So I want to clarify that for Kara before we move on. We are compelled to have a complete history of the last 5 years for the individual. So if they've not resided out of your state in the past 5 years, then the current state will work. But we have to have a criminal history or a comprehensive background check history that shows the last 5 years, including all places of residence. So I hope that answers that for you. So the second of the in-state checks and the next table concerns the in-state sex offender registry check. This is another check that the state may conduct on behalf of the tribes if that is a mutual agreement. It is optional to use a fingerprint to conduct this check. Again, it's going to be completed in addition to the National Sex Offender Registry or the NCIC INSOR and any place of residency in the past 5 years. The third table is the in-state child abuse and neglect registry. It will be done for the current state of residency and any states in the past 5 years. This is a name-based search, and oftentimes the state can conduct this on behalf of the tribes. As we transition from the in-state current residence checks, we'll move to the national checks. The first of the national checks is the FBI fingerprint check. And we must note that the Child Care Development Block Grant Act does not provide explicit authority for tribes to request FBI fingerprints for child care staff members. Tribes may have the authority under a different federal statute to request the FBI fingerprint-based background checks for child care staff. This could include, but is not limited to, state statute, Indian Child Protection and Family Violence Prevention Act, National Child Protection Act, or the Volunteers for Children Act, as well as the Improving Head Start for School Readiness Act. This check must be completed with a fingerprint, and in addition to current state of resident and previous states of residence. There are 4 pre-approved methods with checkboxes in the plan, as well as a list of alternative approaches that you may use. If you choose to select an alternative approach, it will be justified at 2.5.7. You are also asked to select which checks are conducted for each classification of provider. The next national check is the National Crime Information Center National Sex Offender Registry check. That's the NCIC INSOR. Again, there is no federal authority under the Child Care Development Block Grant Act for tribes to access the information through the NCIC INSOR name-based search. The Office of Child Care will consider approaches that do not include accessing the NCIC INSOR name-based search. This check must be conducted in addition to the current state of residence and previous states of residence. The pre-approved methods for tribes to access the NCIC INSOR, again, are listed in the plan. They can be through a state repository, as well as a national FBI fingerprint check that returns the NCIC INSOR. Alternative approaches to checking the NCIC INSOR can be proposed to check tribal sources or private or public sex offender registries. Again, we will justify any alternative approaches at 2.5.7. The final section of the required components of the comprehensive background check section. They will address the described checks for individuals that have lived in other states during the previous 5 years. The first of those is when an individual has resided in other state within the past 5 years. You will conduct a check of their criminal history for any and all states that are in that time frame. This cannot be done by searching a general public-facing website, and it is not required to utilize a fingerprint for this check. Again, we conduct all of these checks to mitigate any reporting gaps. The out-of-state sex offender registry check is the second of the 3 out-of-state checks that must be completed. It's optional to use a fingerprint to conduct this check, and it will be done in addition to the current state of residence, as well as the National Sex Offender Registry. The final out-of-state check is the out-of-state child abuse and neglect registry check. It is a name-based search, and you can work with the other state agencies to have it conducted. Now, are there any questions to this point on the different categories of comprehensive background checks? Okay. Next, we will move into the disqualifying crimes category. Childcare staff members cannot be employed by a childcare provider receiving CCDF subsidy funds if they refuse a background check, if they make materially false statements in connection with the background check, or if they are registered or required to be registered on the state or a national sex offender registry. Potential staff members also cannot be employed by a provider receiving CCDF funds if they have been convicted of any of the following crimes. Those are felonies consisting of the murder, child abuse and neglect, crimes against children, spousal abuse, crimes involving rape or sexual assault, kidnapping, arson, physical assault or battery, or a drug-related felony offense within the preceding 5 years. An option for tribes does exist to do an individual review for those drug offenses. Also included on this list of disqualifying crimes are violent misdemeanors committed as an adult against a child. That would include child abuse, child endangerment, or sexual assault. It also does include misdemeanors involving child pornography. Tribal lead agencies that only use state licensed providers and rely on the state conducted background checks at this point would select no. At 2.5.2.1, tribal lead agencies are allowed to disqualify individuals for employment based on crimes that were not specifically listed in the CCDBG Act. If your tribal lead agency exercises this option, please select yes, describe those offenses, and provide citations to your statutes or your code. ACF will consider alternative approaches where the tribal lead agency implements a less than lifetime ban for offenses that are not crimes against children. Tribes may adopt an individualized review process for determining employment eligibility for those convicted of crimes, again, that are not crimes against children. Tribal lead agencies will justify any alternative approaches at 2.5.7. In this question, you will indicate if the tribal lead agency uses an alternative approach that implements a less than lifetime ban for offenses that are not crimes against children. If yes, you'll check the type of provider to which the alternative approach for disqualifying crimes applies. Would that be tribally operated centers and tribally regulated providers? That would include your center-based childcare and family childcare. Or is it state licensed providers, including center-based childcare and family childcare, your relative providers, or all other providers eligible to deliver CCDF services, including license exempt and in-home childcare providers? At 2.5.3, we discuss fees. The tribal lead agency may not charge fees that exceed the actual cost of processing applications and administering a comprehensive background check, regardless of whether they are conducted by the tribe, the state, or a third-party vendor or contractor. Tribal lead agencies can report that no fees are charged if applicable. Tribal lead agencies that only use state licensed providers and rely on the state-conducted background check policies and procedures should select no. If your tribal lead agency does not charge fees, select no, and CARS will advance you to 2.5.4. Plan guidance at 2.5.4.1 and 2.5.4.2 discuss the timeliness and the privacy of CBC checks. The tribal lead agency must conduct a comprehensive background check as quickly as possible, and the process shall not exceed 45 days after the child care provider submits the request. The question addresses this topic, provides for the selection of an approved approach for all to be completed within the 45-day time frame. A second option is for the tribal lead agency to implement an alternative approach for OCC approval that results are returned after the 45-day timeframe. So please designate also the types of providers that are impacted by the selection in your response. The third option is that the tribal lead agency relies on the state to supply your CBC results. Tribal lead agencies must ensure the privacy of comprehensive background checks by providing the results of the background check to the child care provider in a statement that indicates whether a child care staff member, which includes employees, prospective employees, or household members, is eligible or ineligible for employment, without revealing any documentation or criminal history of disqualifying crimes or other related information regarding the individual. Tribal lead agencies may choose to release aggregated data by crime if there is no personally identifiable information. If the staff member is ineligible, the tribal lead agency will provide information about each disqualifying crime to the staff member. This question asks the tribal lead agency to provide an answer that privacy of the child care staff member is ensured when returning results to the provider. The first response is an approved approach for the tribal lead agency to ensure the privacy of the child care staff member. The next option is an alternative approach, and it's subject to OCC approval that allows for tribal lead agencies to share some information with the child care provider. If your tribal lead agency selects the alternative approach option, please indicate which providers are affected by this decision. The selection of the other approach indicates that you're relying on the state background check system to return your results. ACF will consider alternative approaches on the following requirements from 2.5.4. That is that tribal lead agencies return the background checks within 45 days, that they make employment eligibilities in the event that not all background checks are returned within 45 days, about the ability to share some information with a child care provider. This provision is subject to the limitations of the FBI policy and state and tribal privacy requirements, which may prevent the release of any information. Tribal lead agencies, again, will justify any alternative approach at 2.5.7. Tribal CCDF programs that only use state licensed providers and rely on state-conducted background check policies and procedures should select no. At 2.5.5, child care providers must submit a request to the appropriate tribal or state agency for a comprehensive background check for each child care staff member, including prospective staff members. That's prior to the date that an individual becomes a child care staff member. Prospective staff members have applied for a position but have not yet begun working. A prospective child care staff member may not begin work until at least one of the following results has been returned as satisfactory. Those would be the FBI fingerprint check or the tribal or state criminal registry or repository check using fingerprints in the place of current residence. New staff members are considered provisionally employed during the time from when one of the fingerprint checks has been returned as satisfactory to the time when all background checks are returned as satisfactory. ACF will consider an alternative approach that allows for staff members to be provisionally employed once the background check request has been submitted, but prior to receiving the results of the check. An alternative approach to provisional employment must require that the provider submit all components and the request before the prospective staff person begins working. Under either approach, the provisionally employed staff member must be supervised at all times by an individual who has completed a comprehensive background check. Check the provisional employment approach used by the tribal lead agency at 2.5.5.1. Approved approaches would be for all types of providers that provisional employment is permitted after a satisfactory result from the FBI fingerprint check or the tribal or state criminal repository or registry using fingerprints in the current tribal service area or state of residence. An alternative approach for OCC approval could be for some or all types of providers that provisional employment is permitted after the comprehensive background check requests have been submitted, but before the results of either fingerprint checks have been returned. If the tribal lead agency uses the alternative approach in which the provisional employment is permitted after the comprehensive background check requests have been submitted, please indicate with a checkbox in the CARS system which providers are impacted. Would it be tribally operated centers and tribally regulated providers, including center-based and family child care? Would it impact state licensed providers, both of child care center-based and family care? Does it impact relative providers or all other providers eligible to deliver CCDF services? The tribal lead agency must have a process for a child care staff member, including employee, prospective employees, and household members, to appeal the results of a background check to challenge the accuracy or completeness of the information contained in the staff member's background report. The tribal lead agency needs to ensure the following: that the child care staff member is provided with information to each disqualifying crime in a report, along with information and/or the notice on the opportunity to appeal. A child care staff member will receive clear instructions about how to complete the appeals process for each background check component if the child care staff member wishes to challenge the accuracy or completeness of the information contained. If the staff member files an appeal, the tribal lead agency will attempt to verify the accuracy of the information challenged by the child care member. This concludes making an effort to locate any missing disposition information related to the disqualifying crime. The appeals process is to be completed in a timely manner for any appealing child care staff member. Each child care staff member shall receive written notice of the decision. And in the case of a negative determination, the decision should indicate the tribal lead agency's efforts to verify the accuracy of the information challenged by the child care staff member, any additional appeal rights available to the child care staff member, and the information on how the individual can correct state, federal, or tribal records at issue. The tribal lead agency must work with other agencies that are in charge of background check information and results, such as the Child Welfare Office and the State Identification Bureau, to ensure that the appeals process is conducted in accordance with the CCDBG Act. Each question in subsection 2.5.6, 1 through 3, asks the tribal lead agency to explain the process regarding the notification and the appeals process. And now I'll pass it to Teresa.
Thank you, Tammy. I'm sure that you can use a little bit of a break. So we're going to stop right here and take a moment to ask if anyone has any questions. You can feel free to unmute. You can put your questions in the chat box, whatever works for you. And remember, you can also reach out to your OCC program specialist as well. At the end of this presentation, as in the other presentations that we have done, we will be dropping in the chat box links to the writing cafe for you, as well as the meet and greet that we have scheduled for Friday, to make sure that all of your questions get answered. This is a really important time for you to be able to access all of the experience and skill of the federal staff and TCBC staff that are making time on Friday for you. Also, we are going to be doing office hours. And we will drop the registration link at the end of this presentation in the chat box as well. That will be targeted sessions that will give you the opportunity to address any questions that you have. It will be running through January, so there will be a few sessions there. So be sure and register for that. Once you register, you're registered for all of them. We want to make sure that we give you the opportunity, like I said, to ask any questions and to help you get through that plan. We understand this is very overwhelming. It's a lot of information, but we are here for you. I'm not seeing anything in the chat box at the moment. Would anybody like to unmute and throw out a question? Remember, every question that you ask and every answer that you get in this setting helps out other tribes as well. Okay, I'm thinking at this moment that we do not have any questions, Tammy, so I'm going to go ahead and pass it back to you.
Thank you so much, Teresa. I did appreciate that. I got to get a drink, so I appreciate it. At 2.5.7, we've referenced throughout this entire presentation, we're going to justify alternative approaches. And there have been pre-described methods throughout the check boxes and alternative proposed methodologies. So whatever you suggest, we're going to address at 2.5.7, being mindful that all are subject to ACF approval. This can include a name-based check of tribal records, can be a search of the National Sex Offender Public-Facing website, which is the NSOPW. But we will clarify each of those one at a time as you address each component that you've proposed an alternative approach for. So 2.5.7.1, as Teresa just said, the Office of Child Care wants to hear from the tribal lead agencies. The tribal lead agencies face obstacles in conducting CBC checks. That's due to regulatory or statutory authority. Sometimes it's broadband and connectivity issues. Oftentimes it's geographic constraints. If it's a lack of an ability to secure an agreement with a state or another agency to conduct the checks. At this question, the Office of Child Care is asking you to indicate if your tribal lead agency is experiencing any type of issue obtaining the necessary checks. If you are, and your potential barrier is there, please select it. If your circumstance is not listed, please use the entry of other and describe it. If you have no barriers, we congratulate you, and you'll please select that it does not apply. As a reminder, at 2.5.7.2, we're asking the tribal lead agency to please describe how any alternative approaches that are proposed are as comprehensive as possible and they ensure health and safety of the children in care. Your description should include an alternative approach that details the methods for conducting comprehensive background checks, the implementation of less than a lifetime ban for offenses that are not crimes against children, that the policies that allow your tribal lead agency longer than 45 days to conduct your comprehensive background checks, about policies of sharing any private information with child care providers, and also how the tribal lead agency approaches and handles provisional employment, if any of those are applicable. If the tribal lead agency does not employ any alternative methods for comprehensive background checks, you'll enter does not apply. And I thank you for your time. And now I will turn it to Sarah to close out the remaining time of our session.
Thank you, Tammy. So we have a resource directory for you that we would like to highlight at this time. This document contains a list of all the resources that might be helpful as you complete Section 2 in your plan. When you're looking through it, some of the resources you may see consistently throughout all of our directories, but it gives you specific pages and comments within each of those documents to get you right to where you need to be for section 2. We're going to drop that in the chat box for you. And also, we're going to give you one last opportunity to ask any questions about section 2B and all of the comprehensive background check requirements, and any questions about relative providers and the health and safety requirements around that. We also want to take a moment to highlight some of the tips and considerations that we may have here for you. And let me see. Safi, are you able to open one of the tips and considerations that we covered today?
Certainly. Which one would you like?
Let's start with the first one. Thank you. So there are multiple tips and consideration sheets that have been put together for you specifically for this content. And so as you look at putting together your information, the tips and considerations that we have pulled up right now is determining provider qualifications to ensure health and safety in childcare. So this one is looking at those basic requirements for all allocation sizes for the different types of care. So it gives you a little bit of background information on it and which type of childcare settings that this might apply to. And then as you continue to scroll down, it talks a little bit about why this is important, but also some provider qualification considerations. So making sure that you have that solid foundation of what you're looking for your health and safety requirements and what things that you may be taking into consideration and when and where those things come into play. So are there minimum age requirements for your providers? Is there education or professional standing requirements? And if so, what does that look like within your policies, procedures, and then the types of trainings that you offer? We talked a little bit about some of the health and safety trainings that you can provide and some of those health requirements throughout the training, as well as the importance of background checks. In here, it also gives you some ideas of who you can partner with to help establish some of these settings as well. On to page 2, it talks about some basic qualifications and how to develop some of those professional development plans with your providers and your staff. So things that you might consider and what levels of training are offered and when, and how to kind of develop and establish a process for those things to occur. So it also has some questions for you to consider as you're going through it. And one of those really is talking about the individual differences for some of your providers. If you have an individual who is in a professional development program, such as a CDA or working on an associate's degree, what they need from professional development may look a little different, and how you can kind of build those pieces together to ensure that what you're offering to your providers is helpful. And as we've talked about through some of the other sessions, it was mentioned in 2A, is, looking at the effects of COVID on your professional development now. So previously, maybe you offered, a full week of trainings and got all of your providers the 40 hours that they needed. But now maybe there's a need for some virtual options or kind of a hybrid approach. So what would that look like as you're developing those standards and those requirements? In this tips and consideration, there's also some training resources of some places who do offer different trainings, as well as opportunities for you to look at how some of that's structured to see if there's some of those aspects that you would want to consider in your training as well.
Thank you for describing that. Would you like for me to show another one?
Yes, please. I think we have enough time to kind of hop through all of them for section 2. So this particular one is looking at the monitoring and enforcement policies and practices. And so really it goes over the importance of remembering why we do monitoring and some different aspects for you to consider as you are looking at developing those different policies within your program. We've talked a little bit about relative providers and what some of that might look like when you're looking at your monitoring aspects. And so keep in mind that really the purpose of your reason and the reason for monitoring is to protect the health and safety of the children. And so it kind of goes through for you a little checklist of things that you can do to help assist the caregivers in understanding the rationale behind the monitoring as well. Excuse me. It also gives you an outline of how to help connect your policies and procedures, your training, provider approval licensure, enforcement, all of those different aspects back to your standards and what you have put in place to provide high quality care for children and families in your tribal communities, and linking all of those aspects back together. We talked a little bit also previously about the importance of the certified inspectors and how we can bring all of that together as a component to help us inform our practices and to also continue to educate our providers on why we do what we do, as opposed to it being kind of a gotcha type scenario. Through this tips and consideration, it also walks you through a step-by-step process of how to develop that information and put all of that into place, as well as the components of a comprehensive monitoring system. So you want to look at your monitoring approach, as well as the record keeping and the inspection training and qualification requirements. We talked a little bit about monitoring enforcement. So, once we have all of this information in place, how are we going to enforce it? And what does that appeals process look like? It also gives us some specific information for tribal lead agencies with medium and large allocations, and specifically talking about some of the information that's listed in section 7 of your plan. So how you make this information available to parents and the public, and making sure that this information is in plain language and that you have all of the components in place to make sure that you can determine, if there were serious injuries, death, or substantiated child abuse as a result of any of your monitoring. Thank you for sharing that document, Safi. If you guys have any questions about any of these documents as we flip through them, feel free to come off mute and ask, or to drop your questions in the chat box. So an additional sheet that we have here is also some of the monitoring alternatives. So we've talked a little bit today about programs who maybe have chosen to adopt the state, but also some who have chosen to use alternative methods. And maybe that's a hybrid approach between your state and tribal programs, or some adjustments with your relative providers. So through this tip sheet, it talks about what the purpose of monitoring and enforcement is, and your flexibility in developing a monitoring system or approach that works specifically for your tribal community. It also highlights the importance of cultural considerations, and this may come into place with safe sleep practices or meal times and other foods, and some considerations like that. So some of the cultural considerations that individuals have chosen to put into their plans is also around being able to monitor in their tribal language, or have a person who is familiar with those cultural considerations be the person who goes in to do that monitoring element. So those are aspects that you can consider. Also, if you use your state plan, that you may be able to work out some agreements with your state to be able to have some individuals from your tribal community be certified to be able to do that and take some of those cultural considerations into place. There are also financial considerations listed throughout the tips and consideration. And really this goes into, the amount of undertaking it might be for the tribe to go into their own monitoring system and the financial cost effectiveness of that method. Some relative care provider considerations. This exemption also applies if those individuals care only for relative providers. So keeping in mind that we mentioned that tribal lead agencies can have some exemptions for relative providers, but if another child is being cared for in the home that is not a relative, then that individual is no longer considered a relative provider. So keep that kind of in the back of your mind when you're looking at some of your relative provider considerations. And then we have a monitoring approach and what that might look like for your program. So maybe you have some on-site, maybe there's an alternative to on-site, such as virtual monitoring or some of those aspects that you do. And even some considerations for children who receive care in their own home and what monitoring might look like for those situations as well. Thank you, Safi, for sharing that document. And as you see all these documents, you might think, man, that TCBC team has been hard at work developing these tips and considerations. And yes, they have. We really want to make sure that this information is usable for you and that it's bite-sized. Instead of giving you a large manual with a lot of information, the tips and considerations are really meant to be just short little documents to help you get the information that you need and have it in a way that you can share with your tribal leaders or other members of your team to make sure everybody's on the same page of what your options are when you're looking at running your tribal CCDF program. So this other tips and consideration for section 2 that we have here is looking at the child to staff ratios and group sizes. And so again, there's a little bit of background about what that information looks like. And then your general tips and considerations. And so you get some information here from minimum health and safety guidelines, caring for our children, and what some of that information might look like, so that you can also take that information and compare it to what maybe your state offers and determine, are we okay with going with what the state? Do we want to make any adjustments for ours? And what does that look like as we're taking best practice into consideration as we're developing some of these standards? It also has some information in here about things that you might consider, such as increasing payment rates for providers who have floaters to increase some of those ratios and things like that. You will also see a little chart here with some examples of what child to staff ratios and group size examples might look like and some questions to consider. Really, some of the questions that you might highlight is, what does it look like for my different types of providers? Do I have an expectation for my family childcare homes versus my centers? And in your childcare ratios and group sizes, what type of age ranges are we okay with? And what does that look like within those different groups of providers? And there's a list of some resources here also to help connect you with some of that information to make sure that you have all of the resources you need to make an informed decision for your tribal community. Okay, we're down to our last couple minutes. So we'll flip back to our slide here and give you some reflection questions as you reflect on your session today. And you'll see these throughout all of our presentations. And really, we're looking at what those questions might look like for you as you take this information back to your program. And my goodness, my computer will not let me out of this screen. Okay, so we also want to thank you for joining us. We are going to drop in the chat box some of the resources that Teresa talked about earlier. You're going to find your link for your feedback survey. As it's been mentioned throughout each of these sessions, you only have to fill it out once. We really want to hear your feedback and are really appreciative of you taking your time to be with us and to give us some of that information. On Friday, we will hold a regional meet and greet and writing cafe. We will drop it into we will drop in the chat the registration link for that as well. And then our office hours. TCBC is going to be hosting office hours once a week to talk about the plan preprint, and we'll highlight some specific questions and sections throughout it. So feel free to register for that and bring your questions. Feel free to send any of those questions ahead of time to your regional office or to your TCBC TA specialist, and we will do our best to get all of that information gathered and ready for you. Thank you for joining us for this section. Be sure to reach out if you have any questions. And remember, you can request additional technical assistance from our team by reaching out to your regional office.